All right, well, while everyone's trickling in, I'm going to do a little bit of an introduction for our veterans panel. So thank you guys so much for coming in and sharing your experiences. This is really kind of the star to the show today for me, at least. But I've heard about the research, and of course, that's that. So for this portion, we're going to hear from our 4 Gulf War veterans about their experiences with Gulf War illness research, and how they've been dealing with that, and their advice to you. So first off, we have Jimmy. Jimmy Arocho is a Sergeant First Class retired from the Gulf War. He's going to be our moderator. He's worked with our team as a patient advocate for years. He's really been indispensable. So Jimmy, if you'd like to say anything before?
Yeah, no, thank you.
Great. All right, so we also have Anthony Hardie. As Dr. Klimas mentioned, he's just super influential in Gulf War advocacy, so thank you so much for joining us today. So he is part of the Gulf War Illness Research Program, congressionally directed medical research programs, and then in addition, we also have Bill Watts, who has worked very closely with our Miami team in helping generate awareness of our group, as well as his own efforts in patient advocacy, as well as David Patterson from Roscamp, who is the clinic manager with Gulf War illness research programs there. So in addition to his expertise as a veteran, he will kind of share his experience working in research too. So without further ado, take it away, Jimmy.
Thank you, Zena. Good morning.
Good morning.
Thank you for coming. What I'd like to do during my short time up here is unpackage a little bit of what you heard this morning. And what you heard is very deep science. I look at that science as the leading edge of the scientists working on the solutions. They're going to facilitate quality of life and our future moving forward. What I'd like to do is speak directly to the veteran in more of a tactical way. Jimmy, what should I be focused on, and what can I do as soon as I walk out those doors in the back? I want to thank, of course, Dr. Klimas for giving me the opportunity. She's given me the opportunity to integrate the veteran consumer side of it. Just what's our experience? We were the ones that were on the ground. We were there, and then we brought that back. Also want to thank Aman Chima. She is the program director. That was Zena Kirby. She is the program manager. And she also has a team, Sarah Mohimian. She is a research associate. I'm also a research associate. So thank you. These are the professionals that saw to sharing the science and then opening the door to Gulf War veterans to come up here and, again, unpackage and make that connection. I would be remiss not to recognize, but I want to recognize a few folks that I have not met yet. Is the Dietrich family, Tom? Thank you, Tom, Mary, and Bren. Gulf War veterans family came up from Central Florida, where I also live. Thank you for your advocacy. I'm recognizing directly the advocates that are at this. This is familial advocacy, grassroots advocacy for Gulf War illness. I was contacted directly by the parents. Grassroots advocacy, and I'm going to challenge you, continue on. Hit those immediate goals, and I'll talk about goals right up front, but continue your advocacy. Thank you. Thank you for being here. Also, Mark is he is a hall technician, 2nd class, Navy. Welcome shipmate. These are advocates in the community, extremely powerful, vocal advocates. He has an interesting podcast on a platform named Anchor. He has a number of interviews, very well done. I've listened to most of your interviews, by the way. Very well focused naval professional, and I would encourage for you, please stand up or show folks your hand so they know who you are. Very powerful advocate, Gulf War veteran, Navy. Thank you, Navy man. I also chair a committee of veteran advocates that are across the nation. They're actually, Denise is out of Colorado, Marilyn Harris, she's not here, she's in Houston. Bo Marshall, Bo, please stand up. Advocate, North Florida. He's the part of the group that unpackages this message so that we, veterans, have a tactical way of moving forward with this guidance. And did I miss anybody on that committee?
I think we should have Lieutenant Colonel Sadler next to Bo stand up. Another female.
Thank you. Recognize. Appreciate that. Any other advocates? Anybody else working to advocate for Gulf War illness that I've missed? Thank you.
Jim,
I also...
may we, the veterans that are not active, I'd like them to stand up so that we can get with them individually and encourage them to step out and help us. So if we could have them that are here in the audience.
Let's start first off with any Gulf War veterans in the audience. Will you please stand up? Thank you. Any other veterans? Any other? Thank you. You're an advocate, sir. If you didn't know, you're an advocate now, especially those that serve. Thank you. I've already got the thumbs up, so I deeply appreciate that. Very, very important to advocate. I believe that Dr. Klimas made it extremely clear that just getting the word out it is the paramount challenge. We just got to continue to do that, and we've got to get better at doing that, and we've got to, if you will, we've got to curtail that process so it's an easier process. Because imagine if I went to engage with a veteran and I then started with an elevator conversation like Nancy just did, like Dr. Klimas, and explained to you the science from top to bottom. I would need a very tall elevator to make that reach. It can't be that long. It has to be amore, what, when, where, how, why. Thank you, Jimmy, and then move on. So we're gonna aim to that. We're gonna aim strictly to having an understanding where we can execute on. Thank you again to Dr. Klimas for giving me the opportunity to help feed back to the research through the steps that we have to take as veterans. And I will say right up front, we as veterans have to yield to a few organizations that also make it happen. We've been saying the VA, it's not just the VA, it's the Veteran Health Administration, the VHA, and the VBA, the Veterans Benefits Administration. These are administrations, I'm saying correctly, these are both administrations. We need them because we turn to the VA hospitals for clinical care. Well, when we're not doing research, we have to be cared for on a regular basis. And for those that are experiencing hardships, we need to turn to the VBA for compensation and pension benefits. It's also part of the mix. It has been 29 years. We're very excited about the discussion of research. However, it has been 29 years. That is a long time. Long, long time. The best that I can do historically is I look to the brothers that preceded us in the Vietnam War. It's been 50 years for them to arrive at the 14 presumptives that they have just achieved today. And I think, wow, this is going to be a long, long road. But we're going to shorten it. Like Dr. Klimas says, we're going to get to that business, then we're going to get to the business of talking about our trajectory, the veteran trajectory. I also want to bring attention to another guest, Gregory Ellis. He's actually a Veterans Claims Examiner. Sir, you mind taking a... Thank you. Veterans Claim Examiner. He's a Southern Region. He does outreach coordination. He is a representative, and he can extend an arm. He's that dotted line to those folks, these officials that I strive to share this story so that they can facilitate. He's at the Veteran Service Officer level. He's actually a VCE, which is Veterans Claim Examiner, but he's still at that level that are mass communicating. So if I step out in the hallway and have a 30-minute conversation with you, then that's 30 minutes spent between you and I. Whereas these veteran service officers, they have lobbies full of veterans that walk through the door. They walk through the door with questions. And I tell you just very directly what the questions are. And many of you that have spoken to me in the past can relate to this. But there's 3 things that a veteran could do. And if you're not doing this, please have a discussion with either myself or any of the panel members. 3 things. Walk into your VA clinic and you are connecting with what is known as your patient-aligned care team. First thing that we need to do is make sure that we're getting health care. Flat out. Flat out. Get the health care. That is the first thing. If you're not a member of the VA, then please, we can help you with that onboarding. There's a small onboarding process, ID card, identify with the VA that you are a veteran. You are a veteran, and what you're experiencing is some health-related issues that may be attributable to my deployment in the Persian Gulf, 1990, 1991, Desert Shield, Desert Storm. I'm going to be very deliberate about that. Very deliberate about that. You have to fully identify 1990, 1991 Gulf War. Well, Jimmy, why do I have to be so deliberate? The Gulf War continues to this day. The Gulf War is ongoing. If you don't differentiate that you are a veteran of the first Gulf War, they may miss that. That primary team, that patient-aligned care team, it may go right over their head. You have to identify. So veterans, when you walk in there, tell them, I have concerns. Please take me to the next level. Dr. Klimas tells me very kindly. She says, we will follow the science. Clinicians follow the science. I don't know what's going on with my body. You don't know what's going on with your body, but these people that are in the building, they're going to help me get there. Number 2, should there be identified that there are challenges with post-deployment health care, then you should be referred to specialty care, because your primary care team, your patient-aligned care team, is designed there to do that. They're somewhat of a gatekeeper, and they will refer you to specialty care. I will tell you that after 25 years of being a Gulf War veteran, I came out of the Army as a patient of the VA. 25 years later, I saw a specialty care clinician. That was only after I met Dr. Klimas. I actually learned about her reading Institute of Medicine journals, frustrated with what I was experiencing health-wise. My primary care team wasn't helping me. They treated my complaint as a mental health issue, and it was treated that way, as a mental health issue, for 25 years, until I connected with research. I made contact with Dr. Klimas and her team. She was having a similar session in Miami. So I said, I'm going to jump in the car. I live in Orlando, and I still live in Orlando. I work remotely on this initiative. I'm going to jump in the car, and I'm going to drive to Miami, and I'll tell you, I'll be very honest, I was going to unload on her. What does this doctor think? You know, it's been 25 years, and I'm dealing with some problems. You know what I met? I met a kind, caring, committed professional. That's what I met. Yes. That speaks for itself. That speaks for itself. Very powerful. I was indebted to her. So I said, I'm going to continue to advocate for you. And I took what I learned about what was going on with my body, and I went right back to Orlando to my patient-aligned care team, my primary care provider, and I said, let me share a couple things with you. This is what I'm learning. Oh, really? Where'd you learn that, Jimmy? Some doctor named Dr. Klimas. She's in Miami. I'm going to go ahead and get you over here to specialty care. My neurologist, rheumatology, gastrointestinal, and pulmonary doctors, within a short order, diagnosed me with Gulf War illness. Flat out. Flat out. Spun the display around and said, this is what's going on. It took a long time to get there, and it was just seems like, really, it took this. So how do I unpackage that for you? So again, if you have not seen that patient-aligned care team at your VA, we're in Vision 8, that's Veteran Integrated Service Network here in Florida. There's 7 hospitals throughout the state of Florida, 60 community-based outpatient clinics. Get in there. Get established if you're not. And then those that are in there, but just have made it to the primary care, get that specialty care referral. How do I get that specialty care referral? With these complaints. I was in the Persian Gulf 1990, 1991 Gulf War, and I have some health-related conditions that I consider possibly attributable to my deployment. That specialty care. Once you're in that, settled into that care, are continuously seeing those doctors, developing the picture, then I would suggest to you, think about us, think about the researchers, think about the advocates. Come back to us then. But get yourself seen up front and then double back for the researchers. We're going to be here. The water's warm, just like the Gulf Stream that flows across the east. The water's warm. Come on in. Come on in, please. Please, I'll challenge you with that. Very, very important component of the process. So see the VA doctor, get that referral, those specialty care referrals, and then think about us here in research. Very, very powerful set of steps. And if you're challenged with that process, and I realize it is challenging, there's a lot of gatekeeping going on, some hurdles that are there. We can help you getting past those. It's just more of a communications challenge, I'll be honest with you. It's about communicating and communicating effectively. It's about, again, identifying what war you're associated with and how to mitigate that and get through those channels and get to what you're looking for. I think moving forward, what I'll do is I will continue to introduce the members, and then afterwards, once we all sit down, if then we can ask questions. Is that cool? So formulate them, scratch them on the back of your fingernails, and then develop a nice, big, concise picture of what we have to share with you, and then hit us with the mojo, hit us with what you got. All right? Does that sound good? Thank you, thank you,
Jimmy?
thank you kindly.
Jimmy?
Yes, ma'am.
You mentioned a VA claims person. Do we have a VA clinician in the room besides our people we know?
Any Veterans Administration clinicians at all in the room? Dr. Klimas.
I knew she'd bring
And
it.
there you have it. There you have it. And I'm glad you said that, Denise, because to us, to veterans, remember that the science that we saw leads the definition of the presumptives that we bring to the primary care team and to the specialty care team. In the Veterans Administration today, so the Veterans Administration is way behind the leading edge of what the researchers are discovering. We're way behind it. That is the research plan, and that is the trajectory. Behind that are chronic fatigue syndrome, fibromyalgia, and a functional gastrointestinal issues like IBS, and then some memory issues. Those are the presumptives. That's all we have today. That examiner, he's tied by his bylaws to respond to presumptives. And if that term is new to you, please roadblock me, and we'll go through the presumptives real quickly. But the presumptives is what we get. So what's in it for me, Jimmy? You're up here, it's been 29 years, and you were in the military, big deal, and you were in the Gulf War, big deal. The presumptives is what's driving our motivation. That's helping with the hardships. That's helping with the care. For that veteran, if he's not retired, he may not have an open door, but all of us that are veterans or Gulf War veterans do have an open door at the VA, and we do have the opportunity to receive a free Gulf War health exam, which includes the burn pit registry and the Gulf War illness registries. If those are new to you as well, please roadblock me. Anthony, please, sir.
Thanks.
Anthony
morning.
Hardie.
And I'm going to just speak right from here. Can everyone hear me? Great. Well, my name is Anthony Hardie. I live here in Florida as well. I live over on the other coast, originally from Wisconsin. Served 7.5 years in the U.S. Army. My health issues began while I was still in the Gulf in 1991. After going through an Iraqi bunker complex, that had the characteristic odors of some chemical warfare agents that we didn't know of at the time. Smelled like onions or garlic, characteristic odor of mustard, and geraniums, a flower that my grandmother grew in her garden, and I was thinking of as I was going through these bunkers and thinking, gosh, how odd that it smells like those flowers in my grandmother's garden, and it smells a characteristic odor of lewisite. But we had lots of toxic exposures during the Gulf War. So the pyridostigmine bromide pills that many of us took, anthrax vaccinations and other vaccinations that troops took, the ongoing oil well fires that continued to burn for long after we came home, depleted uranium, and all sorts of exposures. And for veterans out there that I want to especially acknowledge all of the veterans out there that are listening and are watching and are going to be watching probably in the future because this is being recorded. So thank you for joining us, those that are here today. And if you're watching a little bit later, really glad that you're tuning in, and we are extremely mindful of you and grateful for the technology that allows us to talk directly to you as well. Those health issues were fairly significant at the time. I recall laying face down on my cot and coughing up black chunks of what looked like lung tissue at the time. A lot of us developed chronic coughs, some perhaps not as severe as that, but all sorts of issues, skin issues, fatigue issues, which were unusual. I turned the ripe old age of 23 during the Gulf War, and a lot of troops were even younger, 17 and 18-year-old troops, all the way up to 20s, 30s, 40s. But all of us were in very good physical condition, or we wouldn't have been there. And many of us developed our symptoms while we were still in the Gulf, and continued to get worse thereafter. Coming back home, I still had a couple of years on active duty and had some other deployments, and noted that I was slowing down. My cough never stopped, continued until continues until today. All sorts of other health issues as well. So I'm not unusual in that sense at all, but what we've learned since is that these health issues affect about 1 in 3 of us Gulf War veterans. So it's pretty significant. One of my earliest experiences with healthcare, with Gulf War illness, was to be a portent of what was to come. And that was going to the Troop Medical Clinic at Fort Bragg, and my cough that wouldn't go away, the fatigue that was just continuing to get worse. I was in the special operations community, and so was not one to regularly go to the TMC to seek health care. And hearing the screener out in the hallway talking to the doctor and saying, "This is another one of those Gulf War vets who thinks he's sick." That kind of treatment continued for all of us into the VA, and for some, regrettably, it still continues today, which is what is bringing all of us here today as well, because some of us have health issues that are unrelenting, and others have had those that we care about, and then many that are helping to try and solve these issues. One of the first times that I testified before Congress as an advocate, I said a phrase that went something along the lines of, when you're going to see health care, being seen isn't the same as being treated. And we recognized as advocates early on, some of us, Denise, I got to know back in, goodness, I got involved late. I suppose you would say I didn't get out of the military until December of 1993, and I got involved in August of 1995. And Denise, Paul Sullivan, Charles Miles, and others were already advocates at the time. And so testifying before Congress and making that statement really meant to me that we came to understand that the solutions to what we needed weren't when we went to see the doctor, because they didn't know what to do with us. This was a condition that was something that they simply didn't know what to do for us, and they could try and treat symptoms. Or you have a headache, well, let's see what we can do for that. You have skin issues, let's see what we can do for that. You have respiratory issues, well, let's dig into it and see what we can do for that. But often those tests weren't showing up anything at all. But it's sort of like looking, if you're looking for a bacteria that's causing, use an example that's out there today. People are getting sick from this disease called coronavirus. And if you're looking to identify what's coronavirus, well, if I had coronavirus and you're looking at me, you can probably see that I have a fever, and you can see that I have all kinds of symptoms, But if you don't have a microscope and if you don't have the specific technology, you're going to have no idea that it's being caused by this little microscopic bug that's there. And so the tools that were being used in the clinic were simply just not precise enough, not refined enough to be able to look to try and figure out what was happening with us Gulf War veterans. And so as early advocates, we sought to try and change the course of VA to identify, first of all, it was a 5-point mission. First of all, an investigation, full-fledged, to determine what we might have been exposed to. The second, after investigation, was research, evidence-based research in order to identify treatments that might help to ameliorate, to help us with conditions that may have resulted from those exposures. The third was treatment based on that evidence in order to give us evidence-based treatments to help our health conditions that resulted from those exposures. Fourth was compensation for those that were left disabled by their health conditions. And then fifth was never again should we let what happened to 1991 Gulf War veterans happen to another generation of veterans. That 5-point plan continued to guide us forward, and I've got a little timeline that I just want to highlight because it's now going on 30 years since the war, and I hear often from veterans, well, why is it taking so long? Why haven't we got it yet? Or all of this money has been spent on research, and what happened? And so I just want to trace a very brief timeline. 1991, the Gulf War. 1994, 3 years later, the initial legislation for Gulf War veterans' claims. It was inadequate, but it was well-intentioned. 1996, Camisea, the detonations at Camisea were finally acknowledged by the Department of Defense. Regrettably, of all of the efforts of Gulf War veterans, that was the only chemical warfare agent exposure that was ever formally acknowledged by the Department of Defense. We advocates continue to believe that there were countless other incidents, including the January 19th plumes and others, exposing Gulf War troops to the entire arsenal of Iraqi chemical warfare agents at low levels, and perhaps some at, like myself, at acute levels going through at exposures there. 7 years later, the 1998 Persian Gulf War Veterans Acts that paved the way for a research program for Gulf War research, Gulf War veterans. 7 years later, that legislation was passed. It mandated that by the following year that a research advisory committee be created that would be composed of clinicians and researchers and Gulf War veterans and those who represented them who were affected. Well, that was in 1998, and it took 3 more years before that research advisory committee was finally actually stood up by the VA. It took, that committee began its work in diligence, and by just a few years later, it was recognized that there was a new term for Gulf War illness called, what we are calling it here today, a Gulf War illness. 2006, that panel was influential in helping to create the Gulf War Illness Research Program, a very small, by research standards, a pot of money within the Department of Defense in an area called the Congressionally Directed Medical Research Program. And if there's anything that we troops are good at, it's following orders. And so in the Department of Defense, this was a great place to put this pot of money, and it was congressionally directed. It was to be focused on treatments, something that the Department of Defense and VA up until that point were not doing. They were focused, we advocates have argued and made the point that it was focused essentially on proving that there was nothing really wrong with us. By 2008, the Research Advisory Committee had issued a report that in headlines across the world, Gulf War illness is real. And that was the real pivotal and turning point. If all of that advocacy that had happened before then hadn't happened, that committee wouldn't have existed, and the advocates and the funding wouldn't have existed in order for that research to be able to lead to that conclusion by that distinguished panel of Gulf War illness is real. By 2012, the Gulf War Illness Research Program, which I'll just call the GWIRP from now on, a GWIRP, the GWIRP, we had successfully advocated for funding to grow that funding from that little bit of $5 million all the way up to $20 million. We quadrupled it. And it was sufficient enough to establish 2 research consortia, which is just a fancy word for teams. One at Boston University, we heard from Dr. Sullivan earlier, and one here at NSU, Dr. Klimas was influential in that team as well. By 2014, there was a study published about coenzyme Q10. The results had come about earlier, but it was finally published that many years after the war. But it was the first evidence-based, first publication of an evidence-based treatment that significantly improved the health, the symptoms of Gulf War illness. This year, that research now has come to fruition that we have now got clear evidence of something that has been long suspected, that there is neuroinflammation or inflammation in the brain. And from the perspective of Gulf War veterans, the most significant part of that finding, for science, that's a huge finding. That's critically important, and anybody that's involved in neuroscience or in science knows what that means. But for we veterans, what does that mean to us? That means that this is finally evidence, clear scientific evidence that shows a treatable target. So that is really, really significant for us. We advocates are working on a number of different areas. So some advocates work directly with veterans. We heard that there's some here in the room that work on claims. That's critically important. If you remember that 5-point plan of advocates have worked on all aspects of that. So the investigation, research, treatment, claims, and never again. All of those are critically important pieces of advocacy, and there are other areas of advocacy as well. Our advocacy, I would be remiss if I didn't mention that I head up an advocacy organization called Veterans for Common Sense that focuses on a number of areas, but toxic exposures, including Gulf War illness. Our website address is long but simple. It's just veteransforcommonsense.org. Right now, what we're working on actively, as of right this moment, in fact, some of it just this morning, sitting here waiting to come up on the panel, is we're working this Gulf War Illness Research Program, the GWIRP. We have to fight for funding every single year in order to keep it funded. So it expires at the end of the fiscal year if we don't do something active to get it funded. And so just last week, our champions in Congress, Congressman Gregory Ellis from the Northern Mariana Islands, a U.S. territory, and Congressman Jack Bergman from Michigan, and introduced an effort that will continue and expand the funding to allow for, if they're successful, it would allow for expanding to allow one additional clinical trial. 91outcomes.com is a website that I publish. It's just the number 91 and the word outcomes, so 91outcomes.com. We've got information there on what you can do, if you're listening, if you're here in the audience, on what you can do to ask your member of Congress to support continuing that research funding, without which all of this work for the last many years simply goes away. I'd like to mention that every ill Gulf War veteran most likely has a theory in what caused Gulf War illness. And I'm here to tell you that most of you are right. Even though your theories vary, most of you are right. What science has now shown is that mixtures of toxic exposures are likely what led to our illness. And of course, we're hearing from the scientists that there are some that are more likely the root of what's continuing what happened to us. There are others that have perhaps been less explored that may be feeding into it, but we now have a good enough sense of what led to Gulf War illness that we're able to develop treatments, and some of those are now being tested, including right here at Nova Southeastern, right here in the Miami area, over in Sarasota, and on the other side of Florida, and in Boston and throughout the country. And so there are a couple of resources that I want to point out to you as well. If you're looking for a clinical trial, you can go to a website called clinicaltrials.gov. I'll say that again, clinicaltrials.gov, and you can find that information. You can find the information on 91outcomes.com. You can find the information on the Gulf War Illness Research Program website, which you just Google GWIRP, and you will find that very easily as well.
Got a Facebook page.
And there are two Facebook pages that I want to mention. One is called Gulf War Illnesses, plural. Denise heads up another one called Gulf War Illness, singular, and then Gulf War Illness-related discussion. All three of those are Facebook groups that are active as well. And I want to highlight just one last point, and that's that we heard a moment ago from Dr. Klimas, recruitment is why we're slow. And so if you are a Gulf War veteran who is either ill or is healthy but is concerned about, we're having some changes in the sound here, I hope that's okay. If you want to help other Gulf War veterans, actively volunteer to participate in research studies. All of this advocacy that we've been doing, the success that we've had in fighting for, it's now over $200 million in research funding. And I want to highlight how small that is. It sounds like a big number to those of us that don't have $200 million in our wallets. The general estimate out there is that for the pharmaceutical industry to bring one drug to market, it's a rough guess around $1 billion to bring a drug to market. And we have succeeded in getting about $200 million, which has helped to unravel what is causing Gulf War illness to continue, why the exposures that we experienced in the Gulf, why we didn't simply just get better right afterwards and move along, and what we can do about it right now today. So all of that is absolutely critical. And I want to just look at my notes and make sure I didn't forget. So there's one area that I would be remiss in not talking about just very briefly, and that's some of the treatments that I'm taking personally that may be helping. So number one on my list, and I want to add that almost all of the treatments that I'm taking are things that are now currently being studied. They're actively being studied, almost all of them. The first one, of course, is on the list is CoQ10. There are two different versions of it. Both are being studied. I take the version called ubiquinone with an O-N-E at the end, but the other is being studied actively as well. Before I began taking CoQ10, for those that knew me, I was walking with a cane. My pain issues and my joint and muscle issues were so severe that I've been walking with a cane for about 3 years, and that drug alone helped to make a significant difference in those. It's not a cure, but it's been a significant improvement. Theracumin is the nanoparticle version of a drug being tested, of a nutraceutical being tested called curcumin. It's being tested in a couple of trials, including one right here that will be done right here in the Miami-Fort Lauderdale area. Ginkgo is, I take for memory and cognition. Bacopa is another that has a significant impact there as well. That's also now going to be an active trial. A number of vitamins, antioxidants, and anti-inflammatories that are all nutraceutical, including vitamins B, C, and E. That's my nutraceutical package. I take a package for my lung issues, which but they may be having an impact on my overall health as well. So one is a corticosteroid daily inhaler. Another for the chronic bronchitis is guaifenesin, also known as Mucinex. It's available over the counter. I take Nasonex, which is a nasal spray. It's a steroid nasal spray. I take a spray called X-Clear, X-L-E-A-R. Just pronounced, I say X-Clear. Perhaps there's another way that the manufacturers say it, but it's saline plus xylitol. That was funded by, there was a GWERP-funded study that looked at that as well and found that for those of us that deal with chronic sinusitis, before taking this, 17 years of unremitting sinusitis. Singulair, which is also known as Montelukast, which is a prescription-based anti-inflammatory, and then two others that are treatments, but they aren't things that I take. One is that after all of these years of working on these issues, as someone who's been actively engaged on Gulf War illness ever since 1995, finally last year, in 2019, I was diagnosed with very severe sleep apnea. And sleep apnea is an under-recognized and underdiagnosed condition in Americans in general, but I believe particularly in our population as well. And I'm not a snorer. I'm atypical for sleep apnea, and it turned out that sleep apnea, if you have 30 or more episodes in an hour, that's the cutoff for the test that shows that it's severe. I had 93 in an hour, about 1.5 a minute, and not being a snorer was significant. And just doing the test, and during the test, when they put the CPAP on me, for those last few hours of it, when I went to drive home from Bay Pines, over an hour drive, and feeling the difference in my, and finally getting refreshing sleep. I wouldn't even take a nap today without the CPAP. So for veterans out there, one of the things that made a big difference was that there's a new protocol for testing for sleep apnea. I'd had 2 tests before that showed up negative because I never really fell asleep. And the new protocol is that they provide you a sleeping pill to take during the test, just one single sleeping pill, and it allows you to fall asleep. And once you're asleep, now the sleep apnea can be diagnosed. So I'm just putting that out there for veterans out there, that if you feel like you're having unrefreshing sleep, even if you're not a snorer, just like me, get checked out. And then the last one is also actively being studied by studies, and that's dietary issues. And those of us that have become chemically sensitive to all sorts of toxins, well, I believe that the reason that I've become dietary sensitive is because it's probably a similar mechanism, or perhaps the same mechanism, that things that I was able to tolerate before, I'm no longer able to tolerate. So two of those, one is a low glutamate diet, and the second has been very significant for me, and that's the low FODMAP diet, FODMAP. The short version for that, it stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. That's a big mouthful for us veterans. What that means in short is that these are carbohydrates, these are complex carbohydrates, complex sugars. Any sugar is more complex than glucose. And eliminating FODMAPs from my diet was able to significantly change my irritable bowel syndrome symptoms, from having as many as 17 episodes a day for all the years up until 2 years ago, and being able to now go down to where I'm able to have some control based on what I'm eating. If anybody's interested in that, you can Google FODMAP, F-O-D-M-A-P, and you can read more about it. The VA does employ nutritionists, and nutritionists are typically trained in low FODMAP diet. There's an excellent one at Bay Pines for those here in Florida, and I would imagine that there should be those here as well. And so those are some of the things that are helping me to lead a better quality of life. We still don't have a cure, and I still have challenges, but I'm able to be here today with you, whereas just a few years ago, that may not have even been possible. So with that said, I've taken probably more than my share of time, but I hope that that's useful to some veterans out there as well. I know that others here on the panel will have other things to add. And so with that last one, again, please, if you can, you don't have to be a veteran to make a call to your one member of Congress, but in order to keep this treatment research going, in order to try and help all of the Gulf War veterans out there, please make one call to your member of Congress to support the Sablon Bergman Dear Colleague letter on Gulf War illness treatment research. Again, more information is available on 91outcomes.com. Thank you very much, and I'm really grateful to all the veterans that are joining me on the panel and here today.
How about it, Denise?
Okay, I'm going to go through some things that I've been involved since I came home, and being the nurse and observation in theater and all my training in education, I knew something was not right, despite whatever we were being told. So the observation skills I had as a critical care nurse, flight nurse, came into play. And so in the very beginning, just to give you an idea of how the veterans started coordinating, we had, as we got home, I think everybody was getting a computer if they didn't have one. And that was the difference between us and Vietnam vets, is the computer. And in the very beginning, we had the Prodigy Network before AOL or Yahoo or any websites. And it was just a bulletin board. And who it was that started it. And they would look down at us, and I remember them. It was Victor Sylvester, a father of a member that was going over in Desert Storm and had served in Vietnam. Each of them have more to the background than I can have time to cover. But he was the one that put up a bulletin board on the old Prodigy Network. And we collected, at that time I counted, and we grew slowly as the word got out to go to Prodigy. Get on Prodigy, go to this bulletin board. And I think I counted at one time, it started slowly, 20, 30, and I think I counted up to 110, and was across the country. People in California, people on the East Coast. And the key was we had the computers. Many of us got fax machines because not everybody had a computer, but You know, if we could fax something to a local business place or office supply place, they could go pick it up. So we could get some paperwork out to them. And so Victor Sylvester, his nickname was Aussie, very influential, and started getting us going to D.C. We also had Coy Overstreet, a U.S. Marine Corps veteran, Vietnam, a helicopter gunner. He did a whole lot more. He was on the Marine One helicopter. He was involved in, okay. But they were the initial, but that's how it started, and then we progressed. Yeah, I wanted to mention a few things. Veterans that I contact, number one, their comment has been, there's no healthy vets. Yes, there are healthy vets, but they're not on the computer. You know, quite bluntly, we have the vets that are sick on the computer. So we do have, you know, we've quoted 1/3 in the number that we use. So there's a lot of them that are still out there trying to maintain their employment, working. They may be sick, but dealing with it long term. And we really need those. We need them, the controls. Everybody has mentioned it. So one of the things that can help, I think, is we have to get Facebook groups by branch of service and by unit and by state, so that we can target these groups easier to get them in, be it healthy or sick, okay? And we need help doing that. We need individuals that are Marines or Navy to set up a Facebook page, and we can circulate it. Therefore, we also get, if we have sick Gulf War vets, I certainly want to have it with different branches of service. They were in different locations, they did different things, and more or less exposures. So I think that's important to bring out. And the reason I'm bringing this out is I want to meet with the veterans in the room before we leave today to get to know you, you get to know us, because we need help. The ones of us that have been active, and I started as soon as I got home, we need your help. We can't do it all. And our researchers have their jobs to do. So we all need to step up to the plate. Number one, to know that we're not all sick. There are healthy veterans. We need to find them to help. Number two, your frustration when you go in is still there with the VA. And I want to point out the reason that is. Normally you have a protocol you go through. If you're having a body system problem, there's diagnostic tests they can do. We have no diagnostic test available for them to do it and say we have Gulf War illness. So they're struggling too. So don't get mad at your VA providers or your civilian providers, but help educate them. And there's other things I can say about that. But we need to think about how we reach out to each other, and veterans, it's about us. We have to step up to the plate and get better organized and work as a team. If we don't have this teamwork that we had in theater, we won't succeed, and we waste 2 to 3 years on a study getting the, you know, I'm up there fighting to get the funding, and then I'm going, I want everyone, if you need 100 vets, I want to fill those slots. We fought for the money. So I'm going to hand it off to you.
Okay, good morning, everyone. My name is Bill Watts. I'm a Gulf War veteran, as you heard earlier. I served with 405 ADA in the 1st Cavalry Division. I'm also a veteran advocate. I serve as part of some of the different groups that Anthony mentioned earlier. And I would like to start by saying quality of life begins with quality of care.
Yes.
The Gulf War veterans as a whole, because I travel around the country, I see have a trust issue. By this I mean they don't really trust the doctors that they see. They felt like prior they were a guinea pig. Well, I will tell you this. I have one of the 3 doctors I trust sitting in the back of the room today. That's Dr. Klimas. her research teams take pride and show a lot of professionalism in everything they do. I actually help with her research team because I want us to get better. And we can't get better if we do not educate ourselves. If you did not know, at this time, Florida is the #2 veteran-populated state in the United States. We overtook California about 4 months ago. Let's see here, research. Some of the things that the veterans have been saying is they go in and see these young doctors, and I've heard this quite a few times in several different areas around the country, is they'll go in, tell the doctor, hey, I think I have Gulf War illness, and the doctors look at them like, what is that? What is the Gulf War? I've never even heard of that. Some of the doctors coming through nowadays are, you know, late 20s, maybe early 30s, wasn't even born whenever we went to the Gulf War. So they haven't got a clue. So we definitely have to start focusing on educating the doctors in the VA and the outside providers even further. I've worked with Precious Leaks, who is the recruiter for the program. We actually set up a Desert Shield, Desert Storm fishing invitational. If you didn't hear about it, I think we're going to do it again this year. Another statistic for you. There were over 700,000 soldiers deployed from the United States to the Gulf War. Over 300,000 of those are currently sick in some way, shape, or form. Dr. Klimas had mentioned the review panel, so did Anthony. If anyone is willing to serve on those research panels, the Gulf War Illness Research Panel that's funded by the DOD, I have paperwork over in the other room. Come and see me at the Gulf War Clinical Research Table. Let's see here, what else we have.
We, Veterans for Common Sense also sponsors consumer reviewers directly, so get the information from Bill, and we'll be happy to consider sponsoring you if you're interested in serving.
Additionally, I would like to point out something that I'm working on for the veterans. For those that monitor a lot of the websites, I am the Director of Operations for Fishing with America's Finest, and we work closely with veterans that are suffering from PTSD and other mental issues as well as physical issues. I'm trying to work with some of the research doctors to get that research going forward to help the veterans without over-medicating them in a sense. So if you're having some issues like that, also please stop and see me. Dr. Klimas did one of the best studies that I've went through so far. I've done almost every one that she's done. I call her up and tell her, hey, what's coming next? I'm willing to try it. Or I'll go out, I'll see something on the street, cryotherapy or this, and I'll report back to Dr. Klimas. Hey, I did this. This is what happened. What do you think? And Dr. Klimas will always listen to what you have to say. But one of her studies, I never can say this word right, the mifepristone and Embryol study, which she brought up earlier, to me so far, that has been one of the best studies out there. For the first month, the first week of it, I didn't feel that great. Second week, I got a little better. As time went on, it was like almost as if I had been renewed. Then, unfortunately, I was fishing in a tournament on Lake Okeechobee and fell in the water and had a shock to my body, and it sort of killed what we had achieved so far. So I'm highly interested in the second round of the mifepristone Embryol studies when it comes back up. Trust these doctors. They're not trying to do anything that will hurt you. They do not make you feel like you're a lab rat. It's there so others can learn and try to help us help ourselves. So with that said, I would like to pass it off to David.
Good morning. I just have one question, and I'm going to make it really brief. Who here, if you could, would do it all over again? See those hands up? That's why we need to help this research right now. Because we got into this voluntarily. I was 18 years old when I deployed to Desert Shield, Desert Storm. just gotten married, found out my wife was pregnant.
Oh, goodness.
When I returned 6 months later, I was diagnosed with colon cancer. I ended up doing 18 years active duty. And it wasn't until I sat down in a briefing with Dr. Layla Abdullah at the Roskamp Institute, and she put up a slideshow and said, hey, has anybody had these signs and symptoms? And it was 3 pages long. And I put my hand up and I said, and Layla's going to shake her head when I say this, I said, I've had every single one of those, and not a single doctor can tell me what's wrong with me. 18 months later, I'm sitting here right now, suffering from leukemia and 5 organ cancers. Nobody could tell me why. I was scared to go to the VA. I'll be the first one to admit it. Didn't trust them. My father was a Vietnam veteran. Didn't trust him. But as soon as I got in, like Anthony had said, and Jimmy had said earlier, they got me to specialists. I have MRIs all the time. I just had one 2 weeks ago. Found another tumor. But you know what? They're treating me. They have no idea how to treat me yet, but they're treating me. All because I volunteered to get checked out, and they figured out what was wrong with me. So like I said, I'm just going to keep it brief. But that's why I had you guys raise up your hands, men and women, because we would do it all over again, because we have love for our country. Now, let your country love you. Volunteer. Please be part of this research. Thank you.
Please hold on. Let's roll right into the questions. Please hold on now. Let's roll right into the questions, please.
If anyone has questions, you'd make your way over to the microphones on either side, just so everyone in the webcast can hear the questions as well. Please do try and keep these brief. We're running into the clinicians panel as well, and we know you all want to hear from them and their expertise.
Hi, I'm Lieutenant Colonel retired Alice Monaco Rusa Sadler. You don't ever change your name when you are a female in the military, because they will gladly lose whatever record that you have and the associated illnesses associated with that. I was Captain Alice Monaco in the Gulf War. I was 327 Signal Assistant S3 in charge of the rear area operations signal. That was all the signals that came in from the battlefield had to be broken out to Riyadh, to insular Turkey, or to the MMC. So we were a lucrative target, and we received many, many Scud attacks. I stopped counting at 42 because that is the answer to life, the universe, and everything. But that's a reference to Hitchhiker's Guide to the Galaxy. Every time a Scud landed, I would go out and check all of my signal people. So I was out in the open during many Scud attacks that were near hits. The Scud attack that killed the Youngstown, Ohio people was adjacent to us, and my people were part of the recovery operation. I stand today because I wanted to tell you, when we redeployed, these were the elite airborne troops. 327 Signal was the airborne operation. These people were regularly running 6-minute miles in battalion formation when we left. When we returned, they were running 12-minute miles. Many of them were having respiratory illnesses. I became the S1, which is the personnel officer upon our return. And I had urged, I wasn't able to order anything because I was just a staff officer. Only the company commanders could order their troops to do anything, but I strongly recommended everybody start taking vitamins, and quickly, the best vitamins that they could. I did, and it made a big difference. The people that did, I saw significant changes in their performance. And we just had overall degradation of performance of extremely fit troops. So I did want to put that out. That was 327 Signal Battalion Airborne, part of 18th Airborne Corps, immediately after redeployment.
Good morning. My name is James Williams, retired Lieutenant Colonel. I was in Fort Bragg. Also, I was a Brigade S2 for the 35th Signal Brigade. very familiar with what she just mentioned because I was in the same area. Anyway, one of the things I noticed when I came back from the Gulf War immediately was that lack of energy, health issues, all kinds of problems. However, the way I dealt with it at the time was PT, working out, and overcoming those issues. However, over the years, there's a degradation. Your immune system gets compromised. You start feeling tired, and then you start fighting with the VA trying to get recognized for that, which took me at least 10, 15 years to get them to grant me the recognition for the Gulf War. The other thing is I met Dr. Climas on the research study at the Miami VA. I volunteer. I've been an active participant until recently. I encourage anybody who's in the area to please participate in those studies. It's very important. The third issue, which Dr. Climas mentioned briefly, and you just hit on that point, is cancer. I recently got diagnosed with multiple myeloma, and I am suspicious that it has to do a lot with the immune system being compromised. Over a period of time, after a while, your immune system just can't fight it anymore, and suddenly these things happen. So my view is that we're running out of time for many of us. If you don't have it, you may end up having cancer eventually. I'm treating and dealing with it the best I can. However, it's something that needs to be considered on this panel, the relationship between Gulf War syndrome and eventual development of cancer. Thank you.
Yeah, I just wanted to add to that. Thank you very much. That when I went into the VA, and I've only been in the VA now for about 7 months, the first 3 doctors looked at me and said, "How are you alive? You should be dead by now." I had a heart attack at 38. There's been a lot of issues, and like you said, we have to advocate for ourselves. We have to say, why is this? That's why the research is so important, so thank you.
And be proactive. The vets in the audience, prostatic cancer, breast cancer, ask for the screenings earlier than what the normal age requirement is. You push. Men, get your PSA test, the females, the breast. And we are having earlier than normal heart attacks, strokes, pulmonary emboli. Some of the things I wanted to mention real quick. Females, they came back, they ended up with hysterectomies, couldn't carry a fetus to term. So we have that problem with females. The heart stroke, we had thyroid problems showing up. We had the men particularly had renal stones, kidney stones, and that started early, and it continues to this day of men having, and it seems like a higher number than I've seen in the past. Mm-hmm.
Yes, my name is Robert Krog. I was just wondering, with Dr. Klimas's office and everybody, and then you go to the VA, they can't speak. They don't, one doctor can't talk to the other. There's no system in place to talk to Dr. Klimas's people, and vice versa. The only reason Dr. Klimas can get anything is because she actually goes into the VA and does it. But nobody else can talk to the VA or anything, or even get any type of medical records. I have to download it on my phone and send it and give it, because there's just no way that any of, like, Dr. Klimas's office can get anything from the VA.
Robert, that's extremely significant, and what we've learned, and Dr. Klimas actually touched upon it, there is Privacy Act information that is so important that we have to yield to. Now, what we can do as veterans, remember, we're driving, so what you can do is you can elect in your research work, elect to have a copy of your research project put into CPRS or your VA medical records. You can elect that, transfer of information, have that put in there. Once it's in your medical records, then you can call that information, you can request that information, you can download that information and attach it to a claim, continue to build on it, take it to an outside doctor. But please understand, it's all just Privacy Act. We can't make those calls. As doctors are researchers. It is its own silo. And for them to pick up the phone and call, there's so much Privacy Act information that's tied to it that they would be breaking rules.
Okay, the question is is they have us sign those HIPAA Act forms. Why can't they talk? They have us sign the form saying about information passing across, but yet nobody can still talk?
One thing that I believe may be helpful is once you have done that study, then you can take it, print it out yourself and take it to the doctor.
So,
Snail mail.
It's a great question you're asking. It's a problem. I actually just asked the chief of staff to meet with us about that, to try to make that link between what's called community care and VA care much tighter and more communicative. It was really crummy the first year they rolled it out. This year they did some stuff to make it a little easier to get back and forth. But I want to talk to Jimmy's thing about getting your research record into your clinical record, because some of you are trying to get disability, and if you have an expert make the diagnosis, it really helps you. And obviously you can't be in one of our research studies if an expert, meaning us, hasn't made that diagnosis. So it's very, very helpful to actually use your research record to help you get your disability claim process. It's another point. But you make a great point, and it's something we have to actively pursue. I have some good ideas. I'd love to hear your ideas.
And added on to what Dr. Klimas just said, I had tried for years to get chronic fatigue syndrome into my records. I went to Dr. Klimas's CFS clinic. She wrote up all the notes, diagnosed it along with fibromyalgia, and the next thing you know, it finally got approved when I turned it back in.
Okay, see, I've done all that. I actually go to her clinic now, and I say something to my doctor in the VA, and they're, well, like you said, they're too young, they don't understand what's going on, and they don't know how to find anything, and you go to offer it to them, they won't take it because it's not a system on the VA.
Myself and Precious are currently trying to put together something for the Miami VA where we're going to invite the doctors from all the clinics, the chief of staff. Hopefully Dr. Klimas has time to be there as well. And we want to go over a lot of the issues that the Gulf War veterans are having, as well as the research that is going on for the doctors to educate the doctors so they know what to look for and they can recommend the veterans to the correct clinics.
Okay, thank you very much.
Thank you, Robert.
So I want to answer your question. My name is Violeta Reneska. I'm a nurse practitioner at the Institute for Neuro-Immune Medicine in Dr. Klimas Clinic. And I understand what you're talking about exactly. So all our notes, veterans that we see in our clinic, all our notes are sent back to the VA and supposed to be scanned and uploaded in the VA system. As Dr. Klimas told me, they are under Vista images. So if your doctor don't find it, ask him to look under Vista images. Thank you.
I have a question for Mr. Arocho. My name is Rocky Roothouse. I'm a retired Air Force veteran, and I've spent some time over in the sandbox as well. I'm having trouble going through the VA, Bay Pine specifically, as in, all right, we've got step 2. We're going to send you to the specialist. All right, cardiologist, we got that next week. Cool. Neurologist, if you go down to Lee County, you can get it in 2 months, or otherwise you're going to get a call from DC, which actually happened about 5-6 months after the referral. And there's no immunologist at Bay Pines. So I'm going through the outside world. How do we make some sort of link between the research being done here and getting that over to private doctors?
That's a great question. First off, I'd like to say thank you for keeping the Air Force keeping me from being blown up on the battlefield. So the Air Force annihilated all aerial attacks. So thank you for that. Good, recognized. Until electronic medical records get to where they need to, I would approach that as a snail mail process. So if you go see a professional on the outside, get full copies. Ask for full release of the science, of the findings. Take that, and then you can have all of that go to the VA, to go to your clinic, and have every bit of that evidence plowed into your CPRS or your VA medical records. And even more, PDF it and keep it available, so should you down the road, if you find yourself putting in a compensation and pension claim, add that to your medical records, add that as an additional piece to further support your claim until there's that personal information release where electronically it moves back and forth. I believe we're getting close. The VA is actually looking at improved health medical care records, so something to look forward to. Great question. Anything else, sir?
No, that's all. Thank you.
Go Air Force, aim high.
Hello, I'm Mark Chrisman. As you already know, I run a Gulf War podcast, and a lot of my listeners, I know they're probably watching right now or listening, but a lot of the complaints and responses that I get from a little over 4,000 people in general is part of my short-term memory issues too.
Take your time, Mark.
I just lost my train of thought.
So you had 4,000 people that reply to your podcast with the same question.
The care that they receive.
Care, quality of care.
Quality of care, like I mentioned
quality of
earlier.
care that they receive. They hear comments such as, you have pain, well, you should train more like a SEAL. I myself have experienced doctors telling me that they do not believe in the fibromyalgia diagnosis and they don't understand why it's there. And these aren't young doctors. These are seasoned doctors that have probably been practicing for 30 or more years.
Mark, what we're going to do is you and I are going to have a one-off. We're going to discuss on how you and your listeners can start framing your message in a slightly different way with the expectation that it is acknowledged and you're able to move through the Veterans Health Administration, and moreover, should you choose to, you and your listeners move into the Veterans Benefits Administration more seamlessly to free you up for more time for research. How about that?
That would be awesome. And I do have one question. It was actually
sir.
probably meant for Dr. Klimas and her team, but I just recently, through my own research, connected a lot of my symptoms and illnesses that I'm dealing with to genes and playing with gene mapping a little bit. I'm not a doctor, I'm a retired paralegal and a retired PC technician. So I know how to research, but I don't always know how to understand what I'm reading. I was just curious if there's any more studies out there that are directly related to gene mapping and how all of the exposures that we were exposed to while we were over there may have just wrecked our gene map and changed it.
The short answer is yes.
There. We'll get with you guys afterwards.
Yeah, let's do one-on-one and we'll define that.
Okay.
And very briefly, the message that you're carrying right now is a critically important one. There may be VA officials listening in and watching this video today or in the future, and I would just note that it is beyond unacceptable that 29 years after the 1991 Gulf War that we are still having veterans like this veteran who we're talking with right now who are still being told it's all in their heads. And that's unacceptable. The 80% denial rate of Gulf War veterans' claims for fibromyalgia, chronic fatigue, and irritable bowel is beyond unacceptable. And we will continue to fight on those efforts. And thank you for sharing that you're still having these unacceptable experiences.
We're going to go with this other side.
I'm Tess O'Brien, and I hate microphones. Let's see. Okay. Came here from Georgia. So glad I did. I want to thank you all for having opportunities like this, and I want to thank Denise Nichols for getting in my ass about it. Try to do it this way. First of all, I agree with what Chrisman says about how people kind of look at you differently. I'm a Navy vet. Part of the reason it's taken me so long is because I felt like when I was on a ship, I wasn't boots on the ground. And it's invisible. These illnesses that we have are invisible illnesses. So people don't believe it. They don't understand it. I'm concerned about some of the rare diseases that I'm afraid that this causes. I've had to learn that you have to go to your civilian doctors in order to get proof if you want to get your service connection. I'm currently 70% rated. None of it is for anything that I have that's slowly killing me, and none of it is for Gulf War illness. I was diagnosed in 2006 with a primary immunodeficiency. Had to leave my job, had to leave my last year of nursing school. Actually, in 2010, I left my job because my body couldn't take it anymore. For those of you who don't know, primary immunodeficiencies cause other diseases like cancers. I attended a study once I left my job in 2010, the RISK program up in Washington, D.C., headed by Dr. Lee at the time, very smart neurologist. He says, Tess, you have CVID. Okay. They ran a bunch of other tests, found some other things for me. Give me my information about what's wrong with me, go home and get your VA hospital to follow up. Yeah. Okay, well, when you have illnesses like this, your time, your money, your energy, there's never enough of it. Went back to Dr. Lee because after Denise got in my ass about this nutritional study this December, and I went to it. Thank you. Got a lot of good results from it. IBSD has abated for right now. I am organic. Eating much better. I go to see Dr. Lee for a follow-up appointment. Goal for illness used to be whenever you went to the study up there, they had you come back if you got more diseases diagnosed. They don't do that now. Saw Dr. D, did some blood work, and he says, Tess, things are changing. He got out his little notebook that he took all the information down from all the veterans he's been seeing over the years. I was surprised at the amount of numbers of people with rare diseases like mine, CVID, HPP. So I go to the VA hospital trying to get treatment right. I'm getting treatment because I asked my general practitioner, who is awesome, who doesn't know anything about Gulf War illness, but she sends me to specialists if I request it. Told her last year I want to see me a geneticist. Ain't got one. Send me to Salt Lake City then. Hooked me up, did the information, took down all my information, did the blood test, you've got HPP. Oh, and it costs about $1 million or more a year to treat. Go to my VA doctors, denied. Even though I meet the FDA requirements for it, for childhood onset. How are we supposed to continue doing follow-ups when we are doing our jobs at getting the extra information for our VA doctors? I've spent a small fortune getting proof that I have fibromyalgia, proof that I have rheumatoid arthritis, chronic fatigue symptom, and IBS issues. But whenever I send it up, when I go to see my VSO, I get denied. I've got an appeal since 2014 I'm waiting on. And in the meantime, I'm slowly dying. I want to be able to advocate for this. I am a child of Agent Orange. The geneticist tells me that some of your problems are from the Gulf War, and some of it is from Agent Orange, and I'm afraid to continue genomic sequencing on you because the VA will not treat you for this one condition I just diagnosed.
Ma'am?
Okay, and Mr. Hardie, I want to know this. Because I've asked to try these treatments like you have, I use the Clear. I've done the vitamins and stuff like that. But whenever I ask the VA if they've got any of these in their formulary, they don't. And every time I need my immunoglobulin therapy, which I take weekly, they have to special order it. So is there any kind of way that we can get this stuff, the most basics, in an easy way?
Yeah. So the very short version is that to get nutraceuticals into the VA formulary, there's a process for that, and that's where this research is leading. So these phase 3 clinical trials will help us to get there. And I just learned in the last couple of weeks that there's a new protocol at the VA, or at least new to us, that they'll now consider treatments that have at least a strong phase 1 clinical trial. So for researchers in the room, just please be aware of that. If you have a strong phase 1 clinical trial, they will now consider it on a case-by-case basis to get that treatment into the VA formulary.
Hi, good morning. I wanted to thank all of the veterans, first of all, and all of the armed forces that are out there fighting for our country. And I am a wife of a veteran, and I go with my husband to a lot of the doctor's office. Mr. Hardie, he has a lot, maybe every single symptom that you do. And what I want to find out and what I would like to see more is that I understand I've heard everybody here, and we all are seeing the same pains and aches and diseases. And it's not so much about the disease or about the pain, but you are all trying to fight for that, and you're making it more public and more out there for us. I just want to be able to see how much harder can we fight for those veterans that don't want to come out to the public because they are very shy. My husband also, when he came back from the Gulf War, he didn't want to go to the VA. And the VA, as what he's saying, has changed a lot. But it's still very hard. And we have the new practitioner, not the doctors, coming out to see them. And they're kind of dismissing what they feel, what they're saying, because they say, there's no way that you have all of this and you're walking in here. And we still work. We are working full time. And we're not, he's at 30% and he's going through all of this. He has the CPAPs. And I know and I hear them that I don't want to use this because it's a pain in the butt. I don't want to have to be drinking millions of pills and vitamins. And we have those veterans that don't want to because they're just tired and they did what they had to do for their country. Now we want them to be helped. Help our veterans that were signed up, that were told go. Like you said, how many will go back? My husband still say, I'll go back right now. And I'm like, but why? Look what happened to you. And we are here, I am here to represent those, and my family's here. My son wants to give them a better, health follow-ups, or not so much pills and this, more nutrition, more this, but they don't want to do it because they just want to enjoy life for what they have.
Thank you, ma'am. Can I ask you a question?
Yes.
Is your husband participating in
Yes,
clinical
sir.
research?
Yes, he is.
As well?
We were able, like about a year and change, we found Dr. Klimas.
Okay.
And she is, and we
Understood.
are aware, and we're coming out. But again, we work full-time.
Understood.
And it's hard for us to come out.
I'd like to acknowledge primary caregivers. Thank you for what you do. It's very important that there is a representation. Please, let's talk before you leave today.
Okay.
For your cries for participation. Guess what? You're an advocate. You just crossed the line. You're there. And welcome. The water's warm. Your son as well.
Yes.
Welcome. You're also an advocate. Let's talk.
I just
Thank you.
understand that we want to be able to put out the word a little better. I even told my son, maybe you could start the website because
We'll help you.
we're not
We'll help you. It's in the room. We've got the.
We're not savvy at internet. Put it in a billboard, let them know in the newspapers, for our representative, for our governor, for whoever.
Right, and don't forget,
Come
this is
out there
medical.
and reach out to them like you came and say, here's the paper, sign up to go out in our war.
Well, it's also like you just stated, a lot of the Gulf War veterans are still working, and I've had veterans approach me asking, can we get the research, say after 4 or 5 p.m. during the week, or have a Saturday or Sunday research period?
And make the caregivers also aware that they suffer other than just like the normal cold, that they don't know, that they don't understand what they have, and make them aware that they're human. And you're not just a number that it's accumulating in the waiting room.
We're with you.
They are there, and these young, new people are here because of them, because they fought for your country.
I think we could share some very powerful messaging that message will reach those clinicians we have to get better at communicating. That's just all there is. And let me also share, remember, GWI, Gulf, Whiskey, India, Gulf War illness is a research term. So don't walk into your patient-aligned care team and say, I have GWI.
Yeah, they're not.
You
aware.
have presumptives, you have suspicions of presumptive illnesses, chronic multi-symptom illnesses. You're concerned about my fatigue and my fibromyalgia or my irritable bowel syndrome or my IBS.
And the communicating of the computers, of the programs, it is very difficult. The VA is not friendly. We
We'll
go
teach
here,
you.
we go to Miami, and we're moving up to Tallahassee, and they're telling my husband that he has to cut friendship with Miami in order to bring all our stuff. But what about, you lose a lot of the information and the crossing over.
And you are
it's
absolutely
hard.
right.
And you don't want to. You don't want to because you don't want to lose what you have.
I had to move from one VA to the next that are less than 30 miles apart, and I had to cut off everything I had at one to go to the other.
Yeah.
So we'll do one more question over here.
Thank you very much.
Thank you, ma'am.
Very much for anything that you could do.
One last question? Quickly. We're gonna cut it? Okay.
So for the gentleman that had the question, come up and approach any of us afterwards, and we'll be happy to answer your question. And I have one last sentence. It took all of us to liberate Kuwait. It's going to take all of us to defeat Gulf War illness. Thanks.
Thank you so much for all of the stories from the people in the audience as well as our advocates. Really appreciate all you guys have done and are doing now. So if you want to take a seat back in the audience, we did have a break scheduled. So if you'd like to now move over to the atrium, we're doing our poster session for the research portion. But we're also having the clinicians panel here for those veterans and those who would like to hear more of a clinician perspective as well as ask questions of them. So they're going to overlap a little bit. There will be more time in the atrium following the clinicians panel as well. So this is just, if you'd like to stay, please stay and move forward. If not,